Today we will perform an extended arm lift. The fat compartment is not so big, so we'll mostly perform skin surgery. Both arms are different in size, so we will make different plans for different areas. 2 points are so important during this surgery. First, the replacement of the scar. It should be placed as lower as possible around this location. When the arm is abducted like this, the scar is well hidden under the arm. The second point is so important also. So we will stop just before the armpit area, not to damage to lymph vessel. We will do the surgery right now, and at the end you will see the final outcome of our suture line.